Hello everyone. This presentation is on Pingwisen, also called Calm the Stomach Powder. It is on the California Acupuncture Board Herbal Formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Pingwisen belongs to the category transform dampness. A representative pattern is damp stagnation in the spleen and stomach with bloating, poor appetite, and heavy limbs. Important ingredients include Kangju, Hupo, Chenpai, Gankao, Shengjiang, Dazao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 48-year-old man with chronic bloating and greasy tongue digestive complaints. The current medicines are omeprazole, hydrochlorothiazide, metformin. This case gives a possible reason to consider Pingwisen, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Gankao plus hydrochlorothiazide. The mechanism is that licorice can raise blood pressure and lower potassium. The clinical significance is moderate. My management plan is monitor electrolytes and blood pressure. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Hupo plus sedatives. The mechanism is that magnolia bark has central calming effects that may add to sedative medications. The clinical significance is usually low to moderate depending on dose and patient sensitivity. My management plan is use caution if the patient already feels sedated. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Chenpai plus oral absorption. The mechanism is that citrus peel may influence GI function and drug tolerance. The clinical significance is low. My management plan is separate dosing if a patient reports altered medication tolerance. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Pingwisen may be reasonable when the patient truly matches the pattern damp stagnation in the spleen and stomach with bloating, poor appetite, and heavy limbs. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.